Well, any patient who's come into the operating room is going to meet with the anesthesia care team before anything gets started. There's going to be either an anesthesiologist, a nurse anesthetist, or anesthesiology assistant who's going to be part of your care team. Always an anesthesiologist is involved. You'll meet them as you come in to prepare for surgery. The job of the anesthesia care team, first and foremost, is to keep you as the patient safe. And the second goal of the anesthesia providers is to keep you comfortable. So you'll meet with one of the providers. They'll discuss varying options to achieve those goals, both safety and comfort. Now, depending on your medical history, the type of procedure that you're receiving, that can vary. But typically, the most common thing we do is general anesthesia. So that's an anesthetic where you're all the way off to sleep, completely unaware of anything that's happening during the surgery. Anesthesia is actually very safe. A lot of patients come and they're very nervous about the risk with anesthesia, but I often tell patients that you're at a much higher risk of anything happening driving to the hospital than under anesthesia. Having said that, it takes a lot to put your trust in someone that you just met, to watch over every vital function of your body and while you're unconscious during the procedure. You'll have someone of the care team with you the whole time during the procedure, just watching you, making sure you're safe and comfortable, not involved with the procedure, and they follow you through to the recovery period. So if you do have a care team involved with a nurse anesthetist and an anesthesiologist, how that works is the anesthesiologist will oversee all of the anesthesia provided to you for the day. They will be involved in all the major portions of your anesthetic care. So when you go off to sleep, when you're waking up, they're readily available anytime during the rest of the case. And they oversee what the nurse anesthetist does. You'll typically meet your anesthesiologist within half an hour of your surgery. Often it's a brief conversation, so if you have questions, make sure to take that time to ask them. Some of the big things that you'll hear about with anesthesia. So risks involved, mainly their side effects with the anesthesia medicines. So most often we see changes in blood pressure, changes in your breathing. Some of the medicines we use with anesthesia can make you nauseous, and certain patients are at higher risk of being nauseous after anesthesia. So again, depending on your personal situation, you may have more of a discussion with your provider about that. Pain control is a big role of the anesthesia provider. Most people often think of narcotic pain medicines as for pain control, but there's many different medications that we can use to help treat pain. Big questions the anesthesia provider will want to know is if you have any history of anesthetic problems, any allergies to medications, if you have any family history of problems with anesthesia. That will be important to provide to your anesthesia provider. Again, major medical history will just play a role in how they best care for you to keep you safe during the procedure.